What is the proper technique for measuring my arm for a blood pressure cuff? Have you ever wondered how to measure your arm correctly for a blood pressure cuff? This is an important step in managing hypertension effectively. Let's break it down into simple steps to ensure you get accurate readings. First, prepare your arm by removing any clothing from the arm you will measure. This allows the cuff to fit directly on bare skin. Stand or sit comfortably with your arm relaxed at your side. Next, position your arm for measurement. Bend your elbow at a 90-degree angle. Place your forearm straight across your chest or resting comfortably, keeping your upper arm at a right angle to the forearm. Now, it is time to measure your arm length and circumference. Grab a flexible tape measure for this task. Measure the length from the bony prominence of your shoulder to the tip of your elbow. Mark the midpoint on the back of your upper arm between these 2 points. With your arm relaxed at your side, wrap the tape measure horizontally around the midpoint of your upper arm. The tape should be snug but not indent your skin. Record the circumference measurement in centimeters. This measurement is essential for selecting the correct cuff size. An improperly sized cuff can lead to inaccurate readings, often falsely elevated if the cuff is too small. So, how do you choose the correct cuff size based on your arm circumference? Here are the sizes. A small cuff fits a circumference of 16 to 22.5 centimeters, a standard cuff fits 22.6 to 30 centimeters, and larger cuffs are available for bigger arms, which is common in people with overweight or muscular arms. Once you have the right cuff size, place the cuff on your upper arm. The lower edge should be about 2 to 3 centimeters above the bend of your elbow. Ensure the cuff's bladder is centered over the brachial artery, which runs along the inner side of your upper arm. The cuff should fit snugly, allowing you to fit 2 fingers comfortably between the cuff and your arm. During the measurement, rest your arm on a flat surface at heart level. Sit quietly for at least 5 minutes before taking the reading. Keep your back supported, your feet flat on the floor, and avoid crossing your legs. If your arm is too large for a standard cuff and a larger cuff is not available, you can measure blood pressure on your forearm. In this case, position the cuff on your forearm with the middle of the cuff at heart level and place the stethoscope over the radial artery at your wrist. Keep in mind that forearm measurements may read slightly higher, so adjustments may be necessary. Using the correct cuff size and proper arm measurement technique is essential for reliable blood pressure monitoring. This is a key component in managing hypertension effectively. Incorrect cuff size or improper placement can lead to misleading readings, potentially affecting treatment decisions. Always prioritize accurate arm measurement and cuff selection in your hypertension management routine.